I just had a baby, and no matter what I do, I can't nurse. I'm in so much pain. This was a mother we saw in our office a couple of days ago. They found us online and they found out that we do procedures with tongue tie. So how can I help this mother? I'm Dr. Olga Dolger, board-certified pediatric dentist and laser dentist here at Palm Valley Pediatric Dentistry and Orthodontics. Number one reason for postpartum depression is inability to nurse your infant. A lot of moms are under severe pressure. They want to provide the best for their child. They want to nurse and they can't. They suffer, they struggle, they're in severe pain. So let's dig in and see what are the reasons for discomfort and why breastfeeding is important. Since 1970, about 75% of moms initiated the nursing, and only 35% were able to nurse until the age of 6 months. In 1990, the number was the same, 75% initiated and only 50% of women were able to nurse until the age of 6 months. By now, we actually have a goal from World Health Organization. We want to have at least 50% of mothers fully, exclusively nurse babies until the age of 6 months. Because from 0 to 6 months is most important time for the baby, because baby is consuming all the nutrients and all the good things mother can provide for them through the milk. Statistically, surprisingly, in the entire world, only 35% of mothers exclusively breastfed. The rest of us couldn't for different reasons. So what do we do as a country? So first of all, hospitals kind of step back. They don't promote formulas much. They don't offer supplementations. They're trying to actually promote and help moms to position the baby. Lactation specialists are in staff in the hospital. They're helping moms with nursing as well. Sometimes all of those efforts is not enough to help that mom to do the best what she wants to do for her baby. And why is that? Now we started to look inside the baby's mouth. Even in the hospital, they started to do evaluation. It's still not a standard of care. But some lactation consultant, they actually noticed that baby can be lip or tongue tie. So what tongue tie is a little string of tissue under the tongue, which actually restricts the tongue from movement. So tongue should be able to lift to the roof of the mouth, to be able to cup and take that nipple fully and baby initiate the extraction of the milk. A lot of times if the tongue is restricted, they go up and down. They just pump, but they cannot extract the milk. And a little frenulum under the tongue can be a reason why. So ankylosing, it's a big word which describes the restriction of mobility of the tongue. So how can we help? How can I help that crying mom? First of all, in our practice, we actually have lactation specialists who help us assess mother, measure how much baby transfer with mom using sometimes nipple shield or how much formula they can transfer if they already not nursing. So we kind of assess the baby initially. And then if we see oral restriction in the baby, we actually can help. We can release the lip if it's necessary, or we can release the tongue with CO2 laser. Also, lactation specialists keep working with you, explaining how to do different type of exercises, because the snip is not all that baby needs. A lot of times in the hospital, baby get just a scissor clip. If we're not promoting and stretching the tongue, a lot of times we do see reattachments. So it's important to do exercises after release. But overall, why breastfeeding is important? If you look at the entire world, number one reason for infants to die, for example, in third world countries nowadays, is still diarrhea and it's still pneumonia. Mothers who exclusively breastfeed in those countries, the numbers of deaths of their infants is much lower because mother can transfer antibodies from her milk to baby, and baby might not get that life-threatening diarrhea and pneumonia. It's extremely important to know that different diseases like diabetes, asthma, obesity, all the infants who at least 6 months exclusively breastfeed, they had less numbers of those diseases. And it's very beneficial for mothers. Now World Organization actually advising to nurse until 24 months of age. Why? Because it's actually beneficial for moms. Moms have less diabetes, moms have less diseases associated with breast cancer or ovarian cancer. It's all interrelated because it's like one big system between you and your baby. And for moms who can't, we always have alternative. Don't feel shameful that you can't nurse your baby for different reasons. Sometimes it's just not happening for some people. That's important to understand that formulas still have a place. We cannot say, oh, you're not nursing, you're not a good mom. It's important to understand and integrate different moms and different babies and have everybody. Nursing is ideal, but if you can't, there is alternatives as well. So share with me if you had the baby and did you have any problems with nursing? Did you have any issues yourself? Was it painful for you? How long did that pain last? By the way, on average, 2 weeks of pain after having a baby with nursing is absolutely normal. Only if you bypass those 2 weeks and symptoms are still present, then seek help, because 2 weeks is okay to feel some discomfort. That's normal. Of course, look at the baby's mouth and look and see maybe they do have some restrictions, and consult the provider if you unsure what you see. But sometimes we don't gain anything without any pain. But overall, nursing should be pleasant after a certain time. So share with me, let me know if you like this type of videos and conversation. I really appreciate you and appreciate all the likes you gave us. And thank you so much for watching. See you next time.